My name is Dr. Jim Stout. I'm a professor of pediatrics and an adjunct professor of health services at the University of Washington in Seattle. Well, asthma is a very prevalent problem in pediatrics, and an important part of its management is a diagnostic test called spirometry. The problem we initially were trying to address is the fact that spirometry, a diagnostic breathing test, can be done in primary care, but it's not done often enough, and it's not done well frequently when it is done. And we wanted to assist primary care offices in incorporating that procedure into their asthma care. So in response to that learning, we began to develop tools to train primary care practices how to do the spirometry test and how to interpret it for use in primary care. And it began with the production of a multimedia tool known as Spirometry Fundamentals, which was originally a CD-ROM and is now available online. And we studied that and found that it by itself was not enough to improve this test. The study participants told us what they needed was case-based practice led by experts and feedback on the test itself once their nurse or medical assistant was administering the test. They didn't have a way to know if they were doing it properly. So using that information, we built two additional components. The first, a series of virtual classroom sessions led by clinical experts that review cases to embed an understanding of how you apply the principles of this test in treatment decision-making. And then the second was a remote feedback system, software that enables us to upload the spirometry test, study it for technique, and then give very specific feedback back to the point of care, back to the medical assistant or nurse actually performing the test. And what we found, if we do this several times in a row, that we can pretty predictably improve the quality of this test in the primary care setting. Well, I think what's new and useful about what we've done is try to bring together this asthma quality improvement work with distance training techniques and be able to demonstrate that we can change not only knowledge about the test, but actually behavior. We study the curve itself and whether it was done correctly, and so now have this tool that serves both as our training and feedback tool as well as an outcome measure, and allows us to demonstrate improvement over time. The sort of intervention we put together probably has application in a variety of other clinical settings. Different things in medicine that are taught well visually, or procedures where you need to observe and then practice and get feedback, in many cases can be delivered by distance. And I think as the technology continues to improve, we'll see increasing examples of that happening. Well, we've been working with the Center for Commercialization since 2003 and first licensed Spirometry Fundamentals, or the CD-ROM, which we now deliver online, in 2006. And in addition to functioning as our fiscal agent and mentor here at the University of Washington, the C4C has also sponsored two different development projects for us, enabling us to build and then rebuild the feedback reporting system so that now others can use it. And in fact, they're learning to use the tool to deliver feedback to practices in their region and several sites around the country. We continue to look for opportunities to both further expand the work, and we're currently in the process of training other sites to deliver this training using our technology. We hope to work with health plans in the future to demonstrate a reduction in their overall cost of care for patients with both asthma and COPD, which is chronic obstructive pulmonary disease. I think this is just the beginning of a greater emphasis on both training over distance and delivering healthcare over distance.